Hello and welcome to Distillations. I'm one of your hosts, Lisa Berry-Drago. In response to the coronavirus pandemic, we've launched a brand new series focused entirely on COVID-19. Over the next several weeks, we'll be bringing you interviews with people working at the heart of the crisis, including biomedical researchers, physicians, and public health experts. In this episode, I talked with Magda Marquet, a biotech entrepreneur. She currently sits on the board of Arcturus Therapeutics, which is developing a vaccine for COVID-19. She tells us about how a company she co-founded is also taking on the mental health crisis, which has only been exacerbated by the pandemic. And also, she talks about her hopes that the pandemic response could change society for the better.
My background in art history prepared me for the kind of visual culture of this moment and the kind of, you see like the scrolling banners, pandemic and stuff, but
right.
A lot of times what's being talked about, some of like, the vaccine creation and replication rates and things like that. I'm sometimes like, I would really like an expert to walk me through this.
But, you're at the right place, because if you think about it throughout history, pandemics have reshaped not just the economy, but the way we live. So you probably have a better perspective that scientists have, which may be a bit narrow focus. So it's all good.
Speaking of scientists, would you talk a little bit about your background, particularly as it sort of relates to this moment?
Sure. So I started my career as a biochemical engineer in the early 80s, and I started with biotechnology. So at the time, it was very new, and I was kind of wondering, what it would be like. It's hard to imagine what it has become. So as you can tell with my accent, I'm not a native American. I grew up in a small country called Andorra in the Pyrenees Mountains between France and Spain. I went to school in France and went to the first biotech company in Europe called Transgene, where we were working in genetic engineering and recombinant DNA, and that was in early 80s. And then at some point, my husband and I said, if we want to be in biotech, we need to go to the US. And we were 28 years old. We just thought it was an adventure. We quit our jobs, and then we ended up in San Diego. We thought we would stay a couple of years and then go back. And it's been over 30 years, and here we are. So my career has been really riding the wave of biotech and doing, first genetic engineering, then gene therapy, DNA vaccines, becoming an entrepreneur, now becoming also an investor. So I've been kind of looking at almost the whole picture of what biotech has been and continues to be. So it's just a fascinating industry. And I think right now, obviously, there is a lot of emphasis on what we can do to be part of the solution with the pandemic.
Do you see any direct connections between some of the projects that you've been part of and anything that you're now hearing about?
Sure. So I worked many years. I worked for about 2 decades on developing DNA vaccines. So DNA vaccines are nucleic acid vaccines. And the advantage of DNA vaccines is that they can be used at much lower doses, and they can be also safe and easy to produce compared to conventional vaccines. So when I was working at Baikal in the early 90s, I developed methods to produce large quantities of DNA vaccines to inject in humans, because at the time it wasn't an obvious thing to do, and we had to deal with regulatory agencies and make sure that whatever we did was safe and made sense. So I worked with a pioneering team in developing DNA vaccines in the early 90s. And then when I started AltheaDx, which I started the company with my husband in 98, we also developed processes for large-scale production of DNA vaccines. So yeah, all of these experience, I think, is relevant today. And today I'm also on the board of directors of a company called Arcturus Therapeutics, which developed RNA vaccines. So RNA is another kind of nucleic acid type of vaccine. And what we do there is very interesting. We have data at the moment in preclinical models that gives us a lot of hope, because it shows that we can use very small doses if we can, of course, reproduce that at the human scale. But the doses are very small, and also it seems to be producing a response, in preclinical models, an immunological response. So all of that gives us a lot of hope. And to give you an idea, right now the pandemic obviously is a global problem. We need to give vaccines to the whole population, right? Which has never been done before. So to give you a bit of idea of the scale we're talking about, with the Arcturus Therapeutics vaccine and with some assumptions we're making, right? Because we're not in human trials yet. We'll be there in the summer, right? But it looks like with a microgram quantities, which is like a millionth of a gram, we could get a dose, and it would be a single dose, right? So to give you an idea, your thumb is about 10 grams. All right, thumbs up, 10 grams. So with your little thumb here, you could vaccinate 10 million people. So that gives you an idea of, if it works, how relatively easy that could be. So I'm very excited about it, and we shall see, like you said, fingers crossed, right?
That is astonishing. How does it compare to past vaccine development practices, sort of in terms of the volume of vaccine that's needed per, 100 people or?
Right. So there's a very good question. And obviously it depends on the vaccine. And first of all, let me tell you that no one knows if we'll be able to find a vaccine for COVID-19. It's very difficult. And I worked for decades in my career working on HIV vaccines or malaria vaccines, or it's not easy. It's not, we cannot really say that it will work. But if it works, if you look at conventional methods of production of vaccines, it's like done with fertilized eggs, and it takes month and month. It's a very long process. You can have contamination. It can be difficult to do. Then you can also have vaccines that is the virus that is deactivated, and that again could be a major safety concern. Then you also have recombinant DNA vaccines. So right now there's, what's very good about the pandemic, very good. What's very good is that you have all kinds of strategies out there to develop a vaccine. And it's not a race, it's a cooperation. We all have to collaborate together. It's not about, what's the best, and we all have different challenges and positive aspects as well. And we shall see, right? We shall see if we can find a solution altogether.
How have your organizations been kind of responding? So there's the kind of laboratory response, and are there other kinds of responses, communicating things to the public or even to your own teams? What's the feeling been like in the biotech community?
Yeah, in general. So I think the biotech community, it's very interesting what's happening right now, because obviously we are, like I said, many of the companies I'm involved with are really part of the potential solution here, right? So the company I talked to you about, Arcturus, it's a company I'm on the board of, and I think has a lot of potential for vaccine development. As an investor, I invested in Calcimedica, which has a very promising therapeutic. And then I'm an investor in some companies such as Genolite that provide testing for COVID. So I think that if we want to make a difference in COVID, we need to look at testing, number one, vaccine development, of course, and then therapeutic. And therapeutic, you can help people who have a problem right now and cannot wait for the vaccine, unfortunately. So I think it's such a big problem that we're facing ahead of us. So another company that I'm very involved with, because I'm a founder, is AltheaDx. And AltheaDx, we work more on a consequence of COVID, or maybe a parallel problem, because I think that what we are facing right now is not just the pandemic, which is the COVID-19 pandemic, but we also have a huge epidemic of mental health, which has been exacerbated by COVID, because that was there before, but now we're dealing with an uncertainty. Am I going to have a job? How about my 401k investment? It's just very difficult for many people, and it creates a huge problem. So we also work on a test, which is a precision medicine test, to really give to patients who suffer of anxiety, depression, to give them a treatment that can help them right away. So, it's kind of a broad picture. And then I'm also working with other companies who are in clinical trials, and the clinical trials may be delayed, or we may have some problems recruiting patients just because of COVID. So it's a bit of everything. It's every day is a different day, and we're trying the best we can, to make a difference.
It sounds like you're really trying to problem solve on every front at the same time, because that's what this, the pandemic, as you said, is not just one problem, it's a collection of problems.
Exactly. I think it forces us as a society to really look at what we do well, and maybe what we can do a little differently, right? So yeah, to confuse the picture even more and drive you crazy, I believe that I really believe that, if you look at the patients who are the most affected by COVID, there are patients who have some kind of chronic disease, and we all have chronic disease at some, one way or another, just because of the stress and some of the habits that we are facing. So one of my dreams is that we're going to use COVID-19 as a way to maybe to change the paradigm, and going, instead of a sick care healthcare system, we're going to go to a truly healthcare system where prevention plays a big role. So that's my dream. That's my dream. It's like we'll learn something, because what I don't want to do is that we just solve this problem and then we go back and we don't learn. We have to learn from it. So I'm willing to put, all the effort to solve the challenge that's ahead of us, because I think it's very important. But what can we learn from it? We can learn many things, right?
Yeah, the phrase getting back to normal keeps being used. What normal was not working.
Exactly. I mean, no, it's not normal. I think we have, we can look at this situation two ways. It's like, do we just go back to what we had in the past, maybe normal, quote unquote, or can we create something better? Maybe we can.
I'm giving the 10 grand.
And the 10 gram thumbs up.
The 10 million thumbs up.
Here you go. It's a 10 million. No, really. And like we said when we started the conversation, if you look at history, pandemics, they change the course of history. I mean, it all depends on how it will be, how dramatic it will be. Frankly, we don't know. What if it goes away in a simple manner? Then it's going to be, of course, better. But we have a lot of unknowns. But I think that what I hope we'll do is let's put together all our creative power and good intentions and really address the things that maybe were not working that well. So I don't think we will go back. We'll go forward. We will go forward. That's the only way.
We're a history museum. We often focus on the science and making the science, as comprehensible as possible, but we're really a history organization. So your emphasis on history and pandemics really resonates with me, because I think that's one of the places we can look to for, if not solutions, better understanding. I have a question actually from a museum perspective about the kind of material culture of this moment we're in. There's been a lot of emphasis on kind of, the material things that we have to solve the problem and the material things that we don't have. Do we have the gloves? Do we not have the gloves? Do we have the vaccines? Do we not have the vaccines? So I'm wondering, thinking about it from a museum perspective, I'm always thinking, What is the future exhibit about this historical moment going to look like?
Oh, I hope it's not looking like toilet paper. I really hope not.
So I'm wondering what would reflect your kind of experiences in this moment in an exhibit?
Gosh.
What would be the sort of like key objects that you'd go, that was the experience?
Oh, gosh. And I'm going to say something really cheesy here, but I think that what I would like the history to take out of this moment is not the lack of mask or the problems like that we've been ventilators. And I would hope that there's a museum, once we look at this moment, we see maybe holding hands, like an opportunity to get together, to get to the next level, to really reach another level of consciousness, right? And I may be totally out, but when I was reading 21 Lessons for the 21st Century. You probably read that book. Is by Yuval Harari, who wrote *Sapiens*. And even in *Sapiens*, and these books were written before the pandemic, but what he says is that when there are like major problems that face humanity, it's an opportunity for humanity to really go to the next level. It's also an opportunity for humanity to go backwards, to be driven by fear, and then to really become even more protectionist and trying to defend ourselves against perceived enemy. So we really are going to have these two choices, right? And my hope is that in your museum, you see this pandemic as an opportunity to reach a different level, where maybe we create a society that's more conscious, more aware.
That would be wonderful.
Or we can have toilet paper next to a mask.
We can have toilet paper next to it. It's true. It's true. So speaking of kind of the public communication side of it, what have you seen kind of the ups and downs of the way that science is represented? Do you feel like science is something that's reassuring people or feels a little bit remote?
Do you talk about like in the US or all over the world, or
in the US specifically, but
yeah. So I think that unfortunately there is some confusion about science and about the politics in general. And when all of that started, I thought, wow, maybe that will be an opportunity for science to be recognized. It's going to be an opportunity for kids to go and study science again, because that's something that I really am passionate about. Like, how can we get the next generation of scientists? How can we teach young kids and tell them that it's just fascinating, right? The mystery of life and the kind of things we can do. I mean, biotech is amazing, but we don't seem to get much of their attention. So I thought, we're going to get their attention. But then I see that it's very polarized up there. It's really not easy, and the message of science is not clear enough, I think. Right. So, but if you look around the world, and that's why I ask you. I mean, if you look at countries like Germany, for example, where Angela Merkel was a scientist. She's a scientist by training, so she had a very clear approach. She's like, okay, we're going to be listening to the scientists, and then we will make decisions, right? And she had very good results. And here, sometimes we listen to the scientists, but sometimes we give these, confused messages, and leadership has to be very clear, mainly in times that are very difficult. There's no place for confusion. So it's not clear. It should be clear. It should be, science is objective by nature. So I think that if we all work together, we can have better results sooner than if we create confusion.
Chancellor Merkel is a great example of science literacy being useful in those other spheres. Science literacy isn't just for the lab. it's for lots of other space.
Exactly. No, exactly. I mean, it's something that it's so pure, I would say, right? That I don't even understand why it's controversial. But there were like two studies that are pretty clear. One is like women leaders have done a much better job at reopening the economy, and the other one is like women. Leaders who listen to science. So you make your conclusion.
And then we have Merkel right in the Venn diagram of women leader who's well versed in science.
Exactly.
Yeah.
Exactly.
If you could sort of tell our listeners for Distillations, because we have very science conscious and very history conscious listeners, I feel like, at Distillations. If there's anything that you could tell them in this moment, what would you want to say? What would you want them to know, or what would you want to express?
Well, what I would like to express is my enthusiasm for science, for the field of biotechnology. I mean, I spent my career in biotechnology, and I've been amazed about all the things that we can do. And more than ever, I'm so enthusiastic about the fact that we can bring true solutions to the crisis, to the pandemic we're facing right now. So I'm very, despite the colossal challenge that we're all facing, I am excited to do what I do on a daily basis. Wow. Thumbs up.
Thumbs up. That the 10 gram, 10 million.
You'll remember that.
I remember that forever. It was such a great, clear illustration. I mean, that when I think of science communication, I think of things like that, like what is instantly relatable, clear, and useful, that just
exactly
makes your brain expand a little bit and go, okay, my thumb is 10 grams.
Exactly. Here you go.
If it's a millionth of a gram dose, and 10 I'm really going to have that in my head from now on.
Good.
So we're looking at solving a problem, but we're looking at changing changing our thinking, changing our practices. Do you have any other hopes that might come out of it? I feel very buoyed by your energy that you're saying that it's opportunity, that it's forward looking.
Oh, absolutely. Yeah. No, I really think so. I think that my hope is that we'll become more conscious as a society, that all of the things that we knew we were going to, that had to be changed, but no one changed them because we were too busy. Now we have an opportunity to really make the changes needed to go forward. So I'm very optimistic. I really think that we'll be able to create a better place.
Thank you very much.
And be safe.
You too.
All right.
Thanks for listening to this episode of Pandemic Perspectives. We'll be bringing you more interviews from all sides of the crisis, so stay tuned and watch your feeds. As always, you can find all of our episodes, plus transcripts and show notes at distillations.org. And you can find tons of educational resources on our website at sciencehistory.org/learn. The Science History Institute remains committed to revealing the role of science in our world. Please support our efforts at sciencehistory.org/give. For Distillations, I'm Lisa Berry-Drago.